Hi everyone, I'm Dr. Lin of Rehab and Revive Physical Therapy here in Tustin, California. Welcome to a segment of Understand Your Pain. The shoulder video with Melodic Mike has been a big hit and I've been getting questions, and now I want to help address that for you. So let's talk about the AC joint. And the AC joint stands for acromioclavicular joint, and that's where the clavicle right here, the collarbone, and the acromion of the shoulder blade meet together. A lot of people don't realize that the shoulder blade has such a big implication here. So some questions I get from patients are, do I need surgery for this? And I don't want you to drop everything and then run to the orthopedic surgeon right away. You should get this investigated. There's only a few types that really need surgery that I would suggest. It's only when things get arthritic or there's osteophytic changes where there's bony growth starting to impinge on the nerves, the vascular system, or even starting to tear other muscles. That's when those things are absolutely needing to get addressed. But usually the osteophytic changes are a byproduct of something faulty in your biomechanics. And that's how we can prevent them. And I think a lot of these things can be prevented. And some of the reasons we're going to go into next. So here's what's going on. A little bit closer look on the musculoskeletal system. Acromion clavicular is part acromion, which is the shoulder blade right here, and then the clavicle. There's a bunch of muscles that do attach. You got some of the upper trap muscles that can pull your whole segment up, whether it's your shoulder blade or your clavicle. And then a lot of the dysfunctions here happen because of the pec. A lot of people want to use their pec doing push-ups or bench press or flies because they want to pump up their chest. It throws a lot of these things forward. You can see actually how the anatomy of the pec minor and the pec major, they go actually, the pec minor goes to the shoulder blade, can round it forward, and then the pec major can go to and attaches over to the humerus, which actually slides forward. And so these things are things that can create this vicious cycle. Where the shoulder comes forward, and then what gets put on stretch is the bicep. Then people end up with bicep injuries. And then over here you got the rotator cuff injuries because they're put on stretch, and then you have a length tension issue that happens. Supraspinatus, you have infraspinatus, and your other teres muscles. So that's a little closer look of what's going on anatomy-wise with the AC joint. It's multiple different things that are creating this symptom of this AC joint. So AC joint, when people want to have surgery, you want to avoid it because you can try to attack it from all these different angles and really make it a little bit better. So that's what we like to look at over here and try to create the balance. The shoulder blade does account for 1/3 of your range of motion, 33%. So whether you're going out, your arm goes out, or your arm goes forward, we want to address these things. So we're going to paint this classic scenario that some of you might be able to relate to. Some of our daily tasks that really repetitively injure us and can cause this AC joint dysfunction, or even several other shoulder dysfunctions, happens when we're sitting at work. What happens there, where shoulders round forward, our shoulder blade comes off axis. That, remember, attributes for 1/3 of our range of motion. Our pecs get tight, and then what we start ending up with this gorilla posture. And we're doing this repetitively for 40, 50, 60, sometimes 80 hours for some of you. And then you go out for the weekend. So what happens is, because you've been in this position for so long, you've made that length tension change for the rotator cuffs and all these muscles. So then you start using some of these bulkier muscles like the pec, the upper trap, that really reinforce this vicious cycle. So you want to go volleyball, swimming, throwing, playing catch, softball, then you end up with this impingement-like activity. So here's some of the tests that you can try at home. I recommend you going to a healthcare professional and getting this officially checked out, but here's some you can try yourself. What we want to do is, this is called the Nears test. You put your arm down passively. You don't raise it with your own arm, but you raise it with your other arm, and you want to see if it slams or blocks or causes sharp pain Definitely a positive. So you want to look out for that. One of these tests alone doesn't really can be a bunch of different things, but you want to add them up. So here's another test. It's called the Hawkins Kennedy's, bringing your arm out actively, and then what happens is passively you can use your other arm to pull that in, and it kind of looks like this, and then you want to pull that in. If that also is painful, that's also another positive. Another great test I like to use at the clinic is the Yokum's test. So you throw your arm palm flat across the clavicle, and then you try to actively lift this up to your nose, and that's also can be a positive. So if you have this, what's going to happen? What is your course? Do you have to stop working out? I would suggest you stop working out, and that way you stop this inflammation process or the inflammatory process. That could lead down to a very precarious road where you end up tearing your biceps, or you end up tearing your rotator cuff, or you end up with these tendinitises. So that's what you want to be careful of. So cease your exercises. I know it doesn't sound great, but that's the best recommendation at right now. You definitely want to apply ice, and then try the exercises that I have listed below in description. Some great exercises you want is to stabilize, and we can stabilize these muscles with what we have is the shoulder setting exercise, and you can try that about 2 to 3 times a day, 2 to 3 minutes, and then you can add eventually about 2 weeks later you can start adding some window washing exercise below. So I usually get questions, Dr. Lin, what's the normal course of action? I always recommend going to see your manual physical therapist, not just for little stretches here and there or strengthening exercise, but actually someone to help you manually push joints back into place. With that, I recommend twice a week for 4 to 6 weeks. If you're staying around longer than that, then there might be something else going on. And I do suggest going to get a second opinion, whether it's an orthopedic or seeing another physical therapist with another set of tools and pair of eyes. So if you like more content, leave a like and subscribe. I'm Dr. Lin of Rehab and Revive Physical Therapy. Remember, we can and we will get better together.